Alexandra McDermott, and I'm going to perform the bed change skill. And so the first thing I would do is come in the room, knock on the door, state my name. Hi, I'm Alex, your CNA. And then I would proceed to wash my hands and provide privacy for the resident or patient. And so the next thing I would do is I would approach the resident and I would identify them. I already know this resident is Miss Smith, but if I didn't know that, or I just wanted to make sure, I would check her chart, or I could look at a possible wristband. And since this is Miss Smith, I'm going to let her know that we're going to do an occupied bed change on her. And so the first thing I'm going to do is, well, her rails should be normally up, but since they aren't, I'm just going to take the pillow out from under her head. I'm just going to make the rails go up on both sides because they would normally be up. I'm going to take the top sheet off, roll it, making sure she's covered. And since this sheet doesn't seem to be visibly soiled, I don't need to worry too much about the contents inside of it, but we're just going. And now that I have rolled the top sheet down, I'm just going to take the other sheet and roll it completely down, pretending again that it is soiled, so I'm going to roll it away from me and keep all the contents inside of it if there were any. And I'm going to also put that at the bottom of the bed. Keep it down. And she has a sheet. We can take this off of her because she's covered in her gown. Now I'm going to ask for assistance in rolling her, and before I do so, I'm just going to take this top corner of the sheet off. And then Rachel here is going to assist me in rolling her so she doesn't hurt her head. So Miss Smith, we're going to roll you towards Rachel, okay? So what we're going to do is basically just keep untucking, and we're going to roll this inward. Trying to get it as close as possible so we don't have to reposition the patient afterwards. And then we will grab a clean sheet, just clean and folded. We're going to put this in. We're going to tuck this under on the top. On the bottom, and then we're just going to tuck this underneath the clean sheet. So notice that the sheet will only be touching the clean part of the dirty or soiled sheet. And we can also do a soaker pad right now too. Now I'm going to raise this bed rail, and then Rachel's going to turn the resident back towards me. You're going to feel a bump, Miss Smith. Turn up this way. I'm just going to switch sides. Normally she could finish this, but since this is my skill, I'm going to complete the bed change on my own. And so I'm just going to keep pulling everything out this way, making sure that doesn't touch me because it is soiled and doesn't contaminate the new fresh sheets. And then we can just keep rolling this towards the end of the bed. And we can take all of the dirty sheets together now, keeping them away from my body. And put them in the dirty linen. And then I will pull the sheet out. sure it's clean and wrinkle free so that it wasn't. And then we're going to pull this back out. And that looks like it's in a good position on the patient, so we can lay her back down on her back. And then we're going to grab a pillowcase and we're going to put a pillowcase on the pillow. So I'm going to go inside and grab the pillow right here. We're going to do it without touching this new part. Okay. And now that it is clean, we're going to make sure that the head of it faces away from the door. And gently lifting the resident's head, we're going to put your pillow back, Mrs. Smith. Go. And now we're going to put the clean cover sheet on, or bedspread. So we're just going to roll that out from the middle. Oh, wait a minute. I didn't put the other sheet on. Just kidding, Mrs. Smith. We're going to put your regular sheet on. And gently again from the middle, we're going to roll it out. And cover up the patient. And then for the corners, we can just do a simple pleated corner. And then I'm going to do a pleated corner on this side as well. So just tucking this over. I'm going to make sure the resident has enough toe room so that they don't get any sores. And now I apply the top bedspread. So we're going to roll that out from the middle again.
When do you want to finish these?
We'll tuck it in. Now, Mrs. Smith, are you comfortable? And she is comfortable. So now that the top sheet is on and she is nice and clean, we'll give her her call light. So Mrs. Smith, your call light is right here. I'm going to clip it to your sheets in case you need it. And then her bed is locked.
Bed rails down.
Huh?
Bed rails down.
And we're going to put her bed rails back down.
It's a black button underneath.
Oh.
Push it, and then push it forward.
Button in and then
Can you stop it for a second? Sorry. And we're going to put the bed rails back down. And if it said so in her care plan, we would put the bed at the lowest position, but she is safe and she's not at fall risk. So, Mrs. Smith, I'm going to leave now. If you need anything else, just hit your call light, okay? And this skill is now complete.